Turning 40 is a big milestone. It's important to take care of yourself to ensure you're in top shape for the next chapter of your life. With so many things keeping you occupied and busy, you need a good plan for your health. As we age, our bodies go through a lot of changes. While some changes are natural and normal, others can be dangerous if left untreated. One of the biggest concerns is increased risk of developing certain health conditions like diabetes, high blood pressure, and high cholesterol. These conditions are very common, with 1 in 3 people affected by one of these. Importantly, they often remain unnoticed without any symptoms while they silently damage the blood vessels and increase the risk of serious problems like heart attack, stroke, kidney failure, eye damage, fatty liver, and other health problems. As you turn 40, you should check for these conditions regularly. If you have risk factors like being overweight or having family history of these conditions, then you should consider getting checked at an earlier age. When checking your blood pressure, avoid exercise, smoking, and the use of caffeinated drinks like coffee or soda 30 minutes before. Sit and relax for about 5 minutes, and don't talk while the blood pressure is being checked. A normal blood pressure is below 120 and 80. Having blood pressure between 120 to 130 and 80 to 90 is considered borderline high or pre-hypertension. Blood pressure above 130 and 90 is considered hypertension. If your blood pressure is in normal range, you should continue to check your blood pressure every year. For diabetes, there are different ways to get checked. 1. You can check blood glucose after 8 hours of fasting. 2. Do a glucose tolerance test in which blood sugars are checked after taking 75 grams of liquid glucose. 3. You can get a blood test called hemoglobin A1C, which gives us an estimate of blood sugars during the past 3 months. If your screening tests are in normal range, you should be rescreened for diabetes every 3 years. For cholesterol screening, you will need a lipid profile. This blood test checks the levels of different fat in your blood. If your results are in normal range, then you should repeat testing in 5 years. But if you have other risk factors like diabetes, high blood pressure, obesity, or family history of cardiovascular conditions, then repeat testing should be done sooner. If you are in borderline range for your blood pressure, diabetes, or cholesterol, you can improve or stop the progression of these conditions by making healthy lifestyle changes. These include changes in your diet, weight management, and regular exercise. If you have high blood pressure, cholesterol, and blood sugars, then you may need medications in addition to lifestyle changes to get good control. Achieving good control is very important to avoid dangerous complications like heart attack, stroke, and kidney failure. In addition to these checks, this is a good time to develop habits for healthy living. Exercise for at least 30 minutes 3 to 5 times a week. This has many benefits for your heart, metabolism, muscle, bones, and mental well-being. Cut down on fatty and oil foods and refined sugars. Make sure to include vegetables, grains, and fruits as part of your regular diet. Try to lose weight if you are overweight. It will be easier to do now as it gets more difficult to make these changes later in life. And lastly, if you smoke, then quit smoking. Remember, it's never too late to quit. Another important part of health checks is to screen for common cancers to catch them early. Watch our video on cancer screening to learn more. Talk to your doctor to see which specific health checks you should be getting now. Don't wait until it's too late. You can take control of your health today. Remember, age is just a number. What matters is how to have and maintain good health. Stay healthy and help others stay healthy.